It's open enrollment season, a crucial time for about 16 million Texans because this is when people can select their health benefits for 2018. Joining us now is United Healthcare, Medicare, and Retirement in Texas CEO Chris Abbott. Chris, thank you again for joining us today. I know you traveled from far, but tell us just how important is this period in time and why is that deadline so crucial?
Well, Michelle, you're right. It is the Medicare annual open enrollment period. It runs from October 15th, so just started, through to December 7th. This is the time frame when everyone on Medicare, the nearly 59 million Americans who are on Medicare, have a chance to pick their plan for 2018. And it's really important that everybody take the time, take a look at the plans, make sure they have the right one for 2018.
Wow. But you know, thinking about it, because you you have a big list and you don't know how to assess what do I really need, how should people go about that?
Well, I think the best way to do that is if you're on a plan today, take a look at that plan. You should have received the materials in the mail over the last couple of weeks. If that plan is still meeting your needs, you probably don't need to take any action. But it's still worth a while taking a look around. The first thing I tell people to do is take a look at whether that plan is still fits into your budget. Okay. And look past just the premium, look at deductibles, look at co-payments when you get care. The next thing is to make sure that your medications are part of that plan. So when you're on Medicare, typically over 65, you're probably taking some kind of medication. Make sure it's part of the plan. Make sure it's hopefully in the lowest possible tier so that you're paying the least amount of money for that. Make sure you've checked that the doctors and hospitals you like to see are available to you. Again, we want to maintain the relationship that you might have with the physician. By the way, at United Healthcare, we're really proud of the relationship that we have with the WellCare clinics here in the Rio Grande Valley. They do such a great job taking care of our older members. And the last thing is take a look at those extra benefits that come along with your Medicare Advantage program. Things like dental coverage, hearing aids, transportation, fitness club membership, things that traditional Medicare doesn't cover, but Medicare Advantage plans actually do.
Wow, interesting information. And before we finish up, we want to remind residents that deadline and what happens if they don't meet it.
That's right. So you've got to take action before the end of the day on December 7th, because whatever it is you wake up with on December 8th, pretty much what you're going to have for 2018.
Very good. Thank you, Chris, again for joining us.